Hello there, I'm Dr. Jim Collins. Thank you so much for taking some time on today's topic. This is active shooter preparation and response in senior care, part 2. In part 1, I briefly introduced the concept that run, hide, fight was not extremely appropriately suited for senior care facilities, and that a new model, secure, preserve, fight, is more appropriate. So not too long after Homeland Security provided run, hide, fight, that approach to active shooters, many leaders in senior care realized that it just was not ideal. It was not a great model for a healthcare setting. Healthcare employees would not want to leave their elderly residents alone or behind. A group of researchers, thankfully, developed a new method called secure, preserve, and fight to more effectively respond to these events in healthcare settings. But what do each of these mean? That's what I want to cover in this video. Secure. This involves immediately securing essential life-sustaining treatment areas by barricading or securing all access points from the inside. It means turning off lights, turning off equipment that is not needed, and then silencing cell phones. Employees should be well trained in a concept called situational awareness and decision-making during a crisis. Employees need to be trained on interior securing or locking devices for secure and access points. Okay? Silencing alarms and equipment that can draw attention and have emergency care supplies all ready are all a part of this secure part of the secure, preserve, and fight model. Training employees on evacuation and barricading skills is important, and then practicing them regularly is equally as important. That's secure. Now, let's talk about preserve. What does this mean? This involves reducing risk for injury, such as staying away from windows and doors, moving residents to shelter if it's possible, and providing only the essential medical care required to preserve life, hence the word preserve. Staff should be trained on appropriate triage to optimize survival and care. They should practice bystander care and stop all non-essential care. Preserve also involves moving any residents, family members, and visitors to the most hardened and sheltered areas in the community. Employees should also be trained to effectively communicate with the authorities when they arrive. Training staff to handle extreme bleeding is critical because a person can bleed out in between 3 to 5 minutes. And that's the preserve part. Last part, fight. Fighting an active shooter is always the very last resort. It might be necessary, though, when your life or the lives of others are in immediate danger. You may have no other option than to fight off the attacker. Try to use de-escalation and communication before any violence does take place. That's smart. But once violence begins, de-escalation has been shown to be rarely effective. So, training employees to be mentally and physically prepared to come into contact with the attacker is important. There are many items and pieces of equipment in the environment that employees can use as weapons And finally, make sure employees understand if they cannot secure or preserve and they're going to fight, they have to be as aggressive and brutal, and they have to mean inflicting serious harm on the shooter. They have to know that. They can't go into this half-heartedly. They have to go into it understanding that they are going to cause severe damage to that person. I'm Dr. Jim. This has been Active Shooter Preparation and Response in Senior Care Part 2. Take care and be safe.